Aloti News.
The Federal Ministry of Health has begun a 3-week certificate and license verification for community health practitioners. The ceremony was performed by the Minister of State for Health, Dr. Adeleke Mamora, on Monday in Abuja. Mamora urged regulatory bodies to wipe out quacks in the sector and assured them of government's continuous support for training and licensing of health workers.
Distinguished gentlemen, I am delighted to present at this flag-off exercise the nationwide verification of certificates and licenses of practice for community health practitioners in Nigeria. This program will not have come at a better time than now. I believe this is a program that should be carried out on a regular basis, considering the global health challenge of our time that calls for effective and efficient healthcare delivery. The emergence of COVID-19 and the new world order has made it extremely important to raise the standard of training for health workers. Our health workers have always been exposed each time there is a pandemic, and unless they are adequately, effectively, and efficiently trained, they will be prone to reporting high morbidity and mortality. This is one of the reasons why we cannot afford to allow unwholesome practices, untrained, half-trained, and unlicensed individuals to unleash terror on our people. The Federal Ministry of Health identifies with this program and unequivocally approves that the governing board and management of community health practitioners, the Registration Board of Nigeria, carry out this exercise. This is to ensure that well-trained, qualified, and licensed personnel are the ones who entrust the healthcare of our people in primary healthcare centers and other areas where they are found. The government of President Muhammadu Buhari has zero tolerance for corruption. Hence, presenting oneself as a community health practitioner without being trained and certificated and practicing without a license is a form of corruption. The government at all levels and private sector should collaborate to stamp out this societal monster. Quackery in any form is not only evil, it constitutes a weapon of mass destruction. Therefore, see this opportunity to encourage other regulatory bodies to ensure that they redouble their effort in wiping out quackery in the profession. This government, on its part, will continue to support the regulation of community health practice and ensure that adequately trained and licensed health workers are the ones engaged in the health service of the federal, state, and private healthcare institutions. The present administration is not resting on its oars to ensure its healthcare workforce is well and adequately motivated to deliver quality, ethical, and affordable healthcare services to the citizens of our dear nation.
The Registrar, Chief Executive Officer of CHPRBN, Malam Bashir Idris, on his part, said the vision of primary healthcare was meeting the people's healthcare needs.
We did flag off on the verification exercise of our community health practitioner registration board of Nigeria, but specifically to our members, that's J2, CHU, and CHU. The aims of this exercise to verify them, because we have a lot of challenges. People are parading their our members, whereas they don't have our certificate, they don't have our license. That's why we feel we should do that head count. And people are practicing, they are our members, but they are not renewing their license. So, and secondly, we want to develop and establish a data pool for our members in the whole nation. Basically, these are the three things. One, may inform us to do this thing. One, to flush appropriate appropriation. Two, to ensure members that are practicing are renewing their license. Thirdly, to have a pool for community health workers so that we can have the valid data for human resources, specifically to community health workers in Nigeria.